Hi.
Hey, good morning, Tanya. How you doing?
Good morning. Good morning. I'm great. I'm just starting everything up. We are
Okay.
live streaming live. I just want to make sure we sound great. I'll be right back. Hi, Brent. My friend Brent.
Hi.
Okay.
Hey, good morning,
I'm
Tanya. How you
gonna
doing?
like. Good morning. Good morning. Okay. I'm gonna mute myself for a second. I'll be right back in 1 minute. I'm just checking out on my channel. We're gonna go live on. Actually, I'm gonna go live. And Sajad, hi. How are you? And I'm not taking any requests right now, Shanzi. We're gonna do that in 20 minutes, so you won't be disappointed. I'm waiting for my co-host to come back, and let me find out where my stream. We are going. We're live now, actually. On. I just want to see where my channel is and how well we sound. And let me send this to my friend Terry Michael. Share via. Here we go. She's Terry Michael will be joining us also. Um, and we are live on YouTube and everything. So let's see videos. Well, I don't see it, but I'm going to go in the other space. And let me bring up my co-host. Okay, I think Brian, I try to give you the mic. Hold on, let's try it again. There we go. Good morning.
Good morning, Tanya. Good morning, Dr. Kumar. How are you?
Good morning.
Nice to have you back again.
Thank you.
Co-host. Okay, give me 2 minutes. I'm going to go leave the space here. I'm going to turn the audio. I'm going to mute this for a second and we're starting. Hold on. Hi, everybody. Welcome to our health chat. I appreciate everyone for being here. And today I'm here with my co-host, Brian, Psychic Brian. And also we have our special guest back by popular demand, Dr. Kumar. I mean, I think everyone asked us about last time you were here, you weren't here long enough for us. So we had to bring you back. And I'm hoping that we can create a channel with you and start sharing some incredible information because I know you take so many classes. And you go to so many seminars. I've never seen a doctor who's so educated. Oh, hi, nurse. Hi, Nurse Jackie. How are you? So, how are you today, Dr. Kumar?
I'm doing great. Hey, just for your information, over the past weekend, I was juggling three webinars. One was the Rad Fest, one was about hormones, and the third one was about photobiomodulation. So you can imagine, like 14-hour days.
That's a lot of hats you're wearing right there.
No, but it was fun. I really got to understand all three of them. I mean, I had to kind of juggle a little bit, but that was good.
So, Terry, I'm going to bring you up in a few minutes. Terry is also my vice president for my women in communication, but she is also, um, uh, she goes to Dr. Kumar. He's our NAD doctor. So we talk about that. I'm hoping that he will give some data about that. But Dr. Kumar, can you give us a little bit insight about who you are and what you do? I know we've talked before, but while you're doing that, I'm going to go ahead and start getting more people to join in on the chat.
Sure. So I'm a physician. My roots go to being a radiation oncologist. And basically, what that means is I'm trained to use radiation to treat cancer patients. So I've been doing that for about 25 years here in Florida, in the Palm Beach and Port St. Lucie area. And about 6 years ago, I sold most of my practice and then found time on my hands. So I ended up going to Harvard Medical School to train in acupuncture. And that really opened up a whole new avenue for me in terms of, you know, the stuff that was available out there to help patients, but that was not part of what we consider as insurance-based medicine. So that was my entry, and since then, I've been exploring this whole different side of medicine that is making such a huge difference in my life and the life of my patients, not only in those who have cancer, but in those patients who are generally out there in the general population. And a special emphasis on this part of medicine that is really not discussed a whole lot in most fields, and that's sexual medicine. So I've got several areas of interest, but it all boils down to improve the quality of care of my cancer survivors. That was the starting point. But then it started kind of spilling over into other patients. So patients of my cancer patients, or families of my cancer patients were bringing in their relatives for acupuncture, for sexual medicine issues, for hormone replacement, for chronic fibromyalgia, for medical cannabis, for Suboxone. How do you get off from addiction to alcohol, opiates, and not go through this cycle of back and forth to rehab centers. Where can we find a solution to get these patients permanently off these addictive substances? So it's been a fun experience. I mean, this has really brought back joy into my life as a physician. So I know it sounds confusing, but the point is this: what I tell people is, when you consider, let's say, a box full of bottles of water, let's say. So each one has a label. One is a primary care doc. One bottle of water is called your gastroenterologist, or your surgeon, your psychologist, or psychiatrist, your addiction specialist. And people say, so what am I? What kind of a bottle do I call myself? You know what I call myself? I'm the packing material that builds all those bottles together. So I don't call myself a particular bottle, because it's just impossible for me to describe in one word what I do. So I'm basically kind of interlaced between all specialties and just make everybody's life better. Does that help understand without creating confusion?
100% for me, Dr. Kumar. And I appreciate what you're doing. We really need more doctors like yourself. Um, Even in a large city where I used to live, Washington, D.C., it was very hard to find a particular doctor that would specialize or embrace Eastern medicine. They were to the old practice of writing a script for you and not looking at the root cause of certain ailments or diseases.
So what we are seeing recently, again, this is very recent, over the past couple of years, what the push seems to be coming from is through patients demanding this. So Memorial Sloan Kettering Hospital in New York has created an alternative medicine department to help cancer patients. University of Miami is getting into ear acupuncture and all kinds of other stuff. Baptist Hospital down south in the Miami area is beginning to embrace, some of these things that we just talked about. MD Anderson in Houston is beginning to embrace some of these elements, acupuncture and photobiomodulation and all that. So, but the push is coming from patients. It's not coming from physicians. You see, so the medical establishment is beginning to wake up to this reality that the patients will seek this kind of help no matter what. So why not legitimize it, make it part of academia, make it part of research, and let's, because we know these things work. And the reasons physicians are stuck is because it's so difficult to explain how it works. Because as physicians, that's what we've been taught, right, from the beginning. If there's a medicine, I want to know which enzyme it interacts with so I can explain to my patients on why it works. Now, I've taken the approach of saying, yes, it's good to know why, but if it does work, let's go ahead and get it done and then figure out why it works. That can take time, and money needs to be spent into research and all that. But if something has been proven to work, why hold it back until we realize why it works? I mean, yeah, that a patient doesn't care why it works. I mean, the patient wants results, and if we give them results without knowing the how, it's okay with me, right? I mean, why not? So traditional medicine is beginning to look at that. So, but the big push is coming from these big medical centers, which I'm happy to inform that hopefully that will filter down to community cancer centers and into community hospitals. But I think we are still far from it.
Dr. Kumar, it seems that we're seeing an all-time, you know, rise in all types of autoimmune disorders, uh, people getting sick, depression, anxiety seems like an all-time high. Do you think it's something in the environment? What do you think is happening?
Okay,
Um,
that's a great question, and I'll tell you, this new concept. It's been around for a decade or so. It's the gut brain interaction. So I think combined with this epidemic of obesity and autoimmune disorders and mental health, they're all tied into the dysfunction of the GI tract, right? So if your intestines are not able to filter out the good from the bad, absorb the good and leave the bad alone, we would all be healthy. And that was true, hundreds of years ago. I mean, we did not have all these chemicals that were plowed into the ground. Um, and that is part of our ecosystem. So you can't escape, even if you quote unquote eat organic food. The soil that this stuff grows may be organic, but it's depleted of all the nutrients because of reuse of land over and over again. I mean, no matter how you treat it, you have poisonous chemicals in there. You can't escape. That is disrupting the lining of the intestines. Basically, it's one cell thick that's separating your body, from the outside world. You see? So any disruption in there is allowing any of these large molecules to get in, creating this antigenic response. I mean, the antigenic effect with an antibody response that's inappropriate, that's leading to not only the epidemic of autoimmune disorders, but chronic pain issues. And because of the effects on the microbiome in the gut, which is where most of the serotonin in our body is produced that feeds the brain. And if that is depleted, you are going to end up with mental health issues. So it all can be tied down to this major environmental factor that none of us can escape. We can kind of manipulate the microbiome to kind of heal it, using probiotics and on and on and on. But, you cannot prevent the damage from going on despite our best efforts. So I think the first thing is to be aware of what's the real problem. The real problem is the environment. Yes, genetics has a part to do with it, but then there's so many ways of being able to manipulate our genetics through what is called the epigenetic phenomena, which is where we have control over the expression of what we are born with, which is our genes. So we do have some ability to control how our genes express themselves. So I think the first step is to clean up our gut, create a healthy gut, and I think that's going to solve most of the issues. May not be all, but most of the issues.
yeah, it's
Everything else that you do without checking on the gut is a band-aid.
yeah, it seems that even the medical community has learned that disruptions in sleep can affect the gut microbiome, as well as diet, soft drinks, and stress. Those
Yeah.
things that we don't consider are affecting our gut microbiome. Is that correct?
No, so it's a feedback mechanism between the gut nervous system and the brain. So it goes back and forth, back and forth, back and forth. Stress causes GI upsets. How many people have you seen with ulcerative colitis and Crohn's disease? Stress level goes up, their GI symptoms increase. So there's a feedback phenomena. You, you see that? So they're all interconnected. And thank God, Howard Medical School is actually putting up a program that's available online. I think it's sometime this month. It's the Mind Body Medicine Conference. It is available online. So I'm not sure if if the public is allowed into it, but I would urge them to kind of take a look at it, because they come up with some really solid academic information on this huge connection between the mind and the body. And thank God, you know, institutions like Harvard Medical School are beginning to wake up to this.
Yeah, and I was going to ask you, Dr. Kumar, when you were in medical school, years ago, did you learn any of this mind gut axis connection?
Zero, 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 zero. I mean, you listen, but again, what we learned in medical school was set the groundwork, and this was my advice to those people who are interested in medicine or nursing or whatever. Get your basic medical knowledge straight, but do not depend on academia to build on it. You got to figure stuff out on your own, because there's tons of research out there that will back you up in whatever you want to do. There will be support. And again, when you do your own research and what research is legal, ethical, and moral that you can follow, and kind of throw away the junk science that is kind of creeping into medicine. So the reason to go into medical school is to build that ability to screen out the good from the garbage, and you build on it, and that's what's going to make you a good doc. If you think being a good doc is just following what's written in the books, you're going to be left far behind. And the thing is, you're going to be disappointed because you're not going to be able to get the results that your patients are looking for, and they will look for somebody else. They will. They'll spend the time, energy, and the resources to find the doctor that does understand many of these things. And so there's nothing that passes my filter, before I put it into practice. It has to pass the filter of research. And again, it has to be correct research. And I know there's so much of misinformation in this day and age of Facebook and social media. It's so easy to spread misinformation, and so and I understand where people come from. We mix up religion, politics, and science, and that's a really bad combination. I think we need to keep science safe, keep it in the hands of people who understand science, and not kind of mix it up with politics and everything else. And so that is the pain that I'm going through. When I'm trying to separate out beliefs and religion and politics and say, hey, let's clear all that up. Let's get together as scientists and see what works, what doesn't work. Let's hold the foot of the scientists to the fire and not be led by any kind of beliefs without any preconceived notions, and just come in and say, hey, stuff either works or it doesn't work. We should adopt it, or we should, or do some more studies on it, whatever. And again, anything that we do in medicine initially will get rejected, because mainstream medicine doesn't understand it. But at some point in time, the research will come in to back it up, or to say, oh, hey, it doesn't work, so let's drop it. And that's okay. If something that we do is hurting patients, we should drop it. Why not?
So
But
I
yeah,
was
go ahead.
promoting. So Dr. Kumar, let me ask you something. Since you're saying that, like for example, like metformin. I mean, I talk about metformin all the time, and I'm sure you do too. And metformin is originally, it's been around forever, and it's been given for diabetes.
Diabetes, right?
Yeah, but they've shown that it helps bring down the inflammation marker. Can we talk a little bit about that? Because I use that for age management.
Listen, Tanya. So when I talk to my regular doctor and say, "Hey, you guys need to be on metformin," oh, but I'm healthy, dude. I'm not talking about you having, not having diabetes. I'm not recommending metformin for that. But go check out PubMed right now. Put in metformin and anti-aging. You get thousands of articles on how metformin actually is the first step to longevity, and has nothing to do with diabetes. It has nothing to do as a treatment for diabetes. I take 2,000 milligrams a day. Again,
Wow.
So a few people kind of not able to handle 2000 milligrams, had to build up the dose from 500 milligrams a day because it does cause some GI upsets. But one thing also people need to aware of who are on long-term metformin is it will deplete your B12 levels. So you need to get yourself a B12 shot every month. And men, you need to watch out for your testosterone levels because being on metformin can also reduce your testosterone levels. So those are the two caveats that I talk to patients about.
And I noticed that a lot of I'm going to continue with the next subject with the metformin with long-term COVID patients, because it seems like apparently long-term COVID patients seem to develop diabetes or pre-diabetes. Can you talk a little bit about that and metformin with that? Because isn't there a clinical study right now with metformin and LDN?
Oh, so we're talking about two different topics here. So we have metformin on one side that we also already proven beyond a shadow of a doubt on how it has an impact on longevity. Now, low dose naltrexone is a whole different ballgame. Okay. So for people who do not know what low dose naltrexone is, I'll just give you a brief summary of what that is. Naltrexone as a medicine that I was trained to work on at 50 milligrams a day helps patients overcome alcohol addiction. Now, between 1 milligram to 4.5 milligrams a day, it has a slew of effects, both in terms of immune modulation and as an anti-inflammatory agent. So my take on this is, and you guys can find a ton of research on this website called ldnresearchtrust.org. O-R-G. So low dose naltrexone at between 1 milligram to 4.5 milligrams a day. What I tell people is if you have a pulse, you need it. In this day and age, you need it across the board. If you have cancer, you need it. If you have fibromyalgia, you need it. It's one of the building blocks. And this is how it works. People wonder how it works. So, what it does is naltrexone as a chemical blocks to a small extent our endorphin receptors. And what that creates is a surge of, so the body realizes, oh my God, I'm lacking endorphins. So, I need to create more endorphins. You see how it works? So endorphin has all these good chemicals just pouring out, helping the body in so many conditions across the board. So I urge people to go check this website out, ldnresearchtrust.org. And it is a prescription medicine, so you need a physician who can help you out with that. And there are a bunch of compounding pharmacies that do make this available. And it's not that expensive. It's 20-30 bucks a month.
Yeah,
Doc-
I can try to get Skip to come up
Yes.
to do a show with us. And Brian, you'll love Skip. Skip's like one of us.
Yeah.
He's a compounder. He's a pharmacist. Been around forever before me as far as when it comes to anti-aging medicine. I remember back in 2005 me calling him trying to get him to exhibit. He just laughed because I don't need that. but he's very down to earth, very like on point. So I like and also Dr. Kumar, I'm gonna get us a dinner date with him too. So because
Oh, awesome.
I want you to connect with him.
Okay. No, because I use him. Skip's Pharmacy is my go-to guy for LDN.
Did you talk to him? Because
No, I haven't
LDN.
talked to him. No, I just send out the prescriptions to him.
Oh, yeah, LDN helped. Was it my girlfriend, the pharmacist, Kimmy Stoltz, with
Okay.
her Hashimoto? She had
Yeah.
some type of it reversed it and actually got pregnant. She could not get pregnant for years. She didn't think she could ever get pregnant, and she was like considered a skinny fat because she was
Wow.
really skinny, and they thought
Yeah.
she was healthy, but she was considered fat
Yeah. Yeah.
in her inside. So it changed her. So is there something going on with that? I want to try that actually. I want to look. I'm gonna get my blood test, and I'm gonna come talk to you about it.
Yeah, absolutely. It's easy. It's really easy and absolutely no side effects. We tell people just take it an hour before bedtime, and that's it. Simple.
Dr. Kumar, do you think the herb berberine can be just as effective as metformin?
Which one?
Berberine.
Berberin. I'm not sure. Again, metformin is something that's inexpensive, that we can quantify, right? And all the studies are based on that. I mean, I'm sure we can combine the two. You see, if we can quantify stuff, why not? And metformin, like I said, it's been there forever.
Yep.
If people can handle it, go for it. Again, build it up slowly because it will create some GI upsets. And as long as people are aware of the B12, the need for B12, and the need to monitor testosterone levels, we should be good.
We have people in our community that have had COVID and are probably suffering some symptoms of, say, long COVID. There's some inflammation, maybe uh, lingering around if it's
Yeah,
from cytokines or whatever, and they're
yeah.
suffering maybe depression or joint pain. What protocols are maybe in place to kind of treat that, or you or your clinic is helping with things like that?
Okay. So I have a slew of things that are available for them. So, and again, because we don't know the etiology behind this, there are several theories behind this, and so there's a lot of research that's going on. But I'm literally throwing the whole book at them, but step by step by step, and this is how I manage them. So the first thing that we do is what I mean. One of the big issues with COVID is what I think is not only oxygen delivery through the lungs because of lung inflammation, but also oxygen utilization. You see, and one of the things that can really help improve oxygen utilization is ozone therapy. And I think we talked about this the last time. It's called major auto hemotransfusion. Okay, basically we pull out about 250 cc's of blood, just like as if you're donating blood, at a blood camp, and then we infuse ozone into the blood and reinfuse it back into the system. So that way, the red cells that are ozonated are now able to do a better job of transporting oxygen from the lung to the tissue where it's needed and offload it to the areas that it's needed. So that's the first step. That's one thing that we consider. The second thing is what is called whole body photobiomodulation. Now, what is whole body photobiomodulation? The system that I have in my office in Palm Beach Gardens is what's called Novothor. Novothor, and people can go do research on this. There's a bunch of YouTube videos, and what this does is, at about 840 nanometers, this near infrared light, that is near infrared light, red light, uh, has an interaction with the chain, which is what's called the electron transport chain in the mitochondria, that helps form this energy molecule called ATP. So it goes and releases a bunch of ATP, which is the energy molecule, and so that helps kind of jumpstart the mitochondrial function, right? So you have oxygen being delivered to the cells. You are jump-starting the engine in the mitochondria within the cells. And the third thing we do is to pump in another energy molecule called NAD. You throw that in there, IV. I would recommend IV because you can quantify it. You don't have to worry about the effect of absorption if you take it orally. So we do a series of that. Again, it all depends on individuals, and we kind of monitor the results, the feedback that we get from them. So that's the third thing that we do. The fourth thing that I would suggest, and there's a ton of talk that's going on right now, is what's called photobiomodulation of the brain at 10 nanometers or at 10 hertz and 40 hertz. And the company to go to do some research on this, it's called Vlight, Vielight. And this is a company that manufactures and does a lot of research on the effects of infrared light on certain parts of the brain that helps control a bunch of mental health issues. They're designing this protocol specifically for patients with dementia, but I've been using it for like 4 years right now. I mean, I don't know if it helps me or not, but I'm using it because it just makes sense. So that's another thing. The second thing that we need to think about for brain health in COVID is medical cannabis, because I look at medical cannabis as an anti inflammatory agent across the board. Again, people can have different opinions about it, but I think patients would really get a lot of help with medical cannabis. Not only reduce their anxiety and all these mental health issues, but actually have an anti inflammatory effect on the entire body. Then, obviously, we talked about low dose naltrexone. along with the standard supplements that everybody else has been using. Like zinc supplements and magnesium and what else? A bunch of stuff that's available.
NAC. What's your thoughts on NAC, N-acetylcysteine, or
Yeah,
glutathione?
absolutely. There's a huge. I think there's some issues with compounding pharmacies recently. I'm not sure where that is right now, but I have a stock of NAC, and I think Life Extensions also has NAC available, right, Tanya?
No, they're out. They can't get it anymore. We can't sell it.
That's
So
right.
I'm
So
going to come see you because I need my NAD and my NAC.
yeah. But I think NAC should be available through compounding pharmacies. I'll double check on that.
So I want to go ahead and bring Terry up. It's 11:30. This is going to be 60 minutes, and this is a recorded space. I wanted everyone to know that. So Terry, I'm going to bring you up. So Terry and I introduced Terry to NAD, and we did it. We actually hosted our board meeting at Dr. Kumar's office while we're doing NAD infusion. It was awesome. Hey, Terry. Can you hear us? I don't know if you know this, but Twitter had an update, and if you're, and also you need to let your microphone too.
Oh, is my mic on now?
Yes, it's on now.
Okay. Hi, everybody.
Hello,
Hi,
Terry.
Terry.
Hi, Dr. Kumar.
Hi, Terry. How you doing?
I'm doing awesome, and
good.
I would say about 90% of it is because of you.
Thank you.
Yes.
My head just blew up.
Well, it's true. It's true. And just to tell everybody a little bit about me, is that okay, Tanya? Tanya? Are you there?
Tanya has shut
Yes,
down her.
I'm trying to DM Breezy because I'm trying to bring her up. And
all right. Anyway, I just a little bit about me. I have a website, terrymichaelwellness.com, if you want to know who's talking to you. I became friends with Tanya about 3-4 years ago. I had just moved to Florida, and I'm a certified Pilates instructor. I'm all these healing modalities, Reiki, access bars. I'm totally into health and wellness from the inside out. I got involved with Tanya regarding the Association of Women in Communication. I feel it's a very, very important team that we have and what we do. And she introduced me to Dr. Kumar. And my first meeting with him was the NAD. And we had our NAD infusions. It was absolutely fabulous. And now I've been doing it at least every 3-4 months. My second infusion, I decided, you know what? I'm going to see something here. I'm going to see if this really works. And I did a little bit more than I normally do and decided to quit drinking completely. I've drank wine since my 20s, at least every day. And I decided, you know what? The more research I did on drinking and NAD and all that, I thought, you know what? Drinking alcohol to me ages you from the inside out. You just don't see it for a while. And I didn't want that happening to me anymore. I was 65 last year. I'm 66 this year. And on my 66th birthday, I had an NAD treatment. I brought my girls at Dr. Kumar's office. It wasn't quite a party, but it was sort of an NAD party. And I have not had a drop of alcohol since, which is a big deal. So I just wanted to share that with you, that yes, Dr. Kumar is right on for somebody who is, and I apologize for the dog, for somebody who is to be in the business that he's in regarding cancer. It's a perfect fit, because what people need more than to reverse what's going on in their body than a cancer patient. And that's what NAD does. It brings you back to where you should be. And that's really about it. Also this year I am working at a retreat called Balance for Life, and something stuck out to me that Dr. Kumar mentioned about, or it might have been Brian, about how many more people now have anti-inflammatory diseases and just things wrong with them, period. I mean, I've gotten today I got a potential guest that wants to water fast, and they want to lower their blood pressure. They're overweight. Everybody is talking about overweight, and I've got people coming in, flying in, driving in from all over the country wanting to get well. And we do water fasting, juice cleansing, and plant-based diets. So we are in a sweet spot right now, but there's more we can do for these people. And I know, Dr. Kumar, you're it. You're it. And that's what I have to say. Go ahead.
Thank you, Terry. And I brought my good friend Brisa up here. She is a leader in women in NFT and NFT itself. Actually, she's always sharing stuff with me. So I'm so thrilled that she is here. How are you? And good morning. This is early for you.
It is early. Good morning. And this is such a great discussion about so many things that I love so much. And hello, Brian. Nice to see you up here. Good morning. And Dr. Kumar, thank you for your time. This is great. I have a few questions. One is, what is NAD? And two, I'm 37, but my partner is 54, and he is terrified of needles, like disgustingly terrified of needles. And I myself have a holistic doctor and a general practitioner doctor. And what I have learned from all of my recent medical graduate friends is that nutrition is really not discussed at all in the medical field. And my dad was diagnosed with prostate cancer in 2016. And that was when we learned about plant-based diets and vegan diets and just turmeric and anti-inflammatory eating, CMOS, bladder whack, things like that. And none of my recent medical graduate friends knew any of what I was talking about at all. And it was a little disturbing to me to think that that was 2016. And here we are coming into 2021 with things like COVID. And people do not recommend vitamin D or turmeric supplements or doing any basic things. So for someone like my partner who is terrified of infusions, I mean, doesn't even want to get his blood test, doesn't want to do any of those things, what are some other alternatives to NAD? And if I'm understanding, NAD is like a blood transfusion, an oxygenated blood transfusion. Is that correct?
No, no. So I think we are confusing ozone infusion, the what's called the major autohemotransfusion, with NAD. So NAD is different. NAD stands for nicotinamide adenine dinucleotide. So the way you look at NAD, so let's talk about NAD first, and then I'll talk about the ozone next. So NAD, so there are two units of energy currency in our body. Okay, one is NAD and one is ATP. So in other words, look at NAD as gasoline and ATP as diesel, for example. So you can put gasoline into this car, that car, whatever car, and it works. So same thing in the body. ATP goes in and helps the muscle cell to contract. It makes you give ATP and you exchange it for the heart muscle to contract. You give a unit of ATP to the nerve cell and it sends out the message. You see? And so NAD does the same thing too. So between ATP and NAD, this is the fuel that drives our entire system. All the system is the body. Okay. So what happens is with NAD, it declines with age. So when you find these little kids running around, what do we say? Oh, these kids have so much of energy. That is literally true because they've got tons of NAD, right? And as we get older, what do you say? Oh, I don't have that energy. Guess what? That is actually true. You don't have NAD enough. But what if we plunk in a bunch of NAD into your system to a level that you had at the age of 20? You will feel like a 20-year-old because now you have your energy level of a 20-year-old. I mean, again, I don't know how many people want to be 20-year-old again, but you get the point. So the most sure way of getting NAD into the system as we get older to restore that balance to an earlier age is through a direct IV infusion. And again, So when people talk about needle phobia, the alternative is with oro NAD, and there are a bunch of supplements. There's one called NR, NMN. There's a company out of Boston that's manufacturing a supplement called Basis. So there are different forms of this oral NAD that's coming on board. But the problem with that is, number one, we do not have a blood test to measure NAD levels. So we don't know how much of this stuff is actually getting absorbed into a system. Okay. Whereas with IV infusion, you will feel it. You will feel it right away. So I know for sure that this chemical is getting into your body and going into the area that we know that your body needs. You see, so that is the main reason why I would prefer patients getting an IV infusion versus a pill form. The other reason is it's easy to saturate the body with IV NAD, because the way you look at it is, it's not that we are making less of NAD, but we are also creating this huge hole in the system that's draining NAD. So you got two things to worry about. The reason your NAD levels are low is because less being produced and more being taken out. So it's a big drain on the system. So so if you have to replace this mess, this the most sure method is to saturate the body with IV NAD. It's like taking the gasoline out of the pump and directly pushing it into the gasoline tank, rather than, okay, quote unquote, throwing a gasoline pill into the tank and hoping it works, right? So that's part of the NAD. So it's basically restoring your quote unquote energy levels. Ozone therapy is a different ballgame. So the way ozone therapy works is, as we get older, one of the issues that we face is reduced oxygen utilization. Now, what does that mean? Very briefly, this is what it means, and I'm going to just give you a concept. So let's say we breathe in 100 units of oxygen and we breathe out 99 units of oxygen. So how much has the body utilized? 1 unit of oxygen. But what if we inhaled 100 units of oxygen and blew out 10 units of oxygen? Now, what has the body utilized? 90 units of oxygen. Now, we want to utilize 90 units of oxygen because that's a sign of health, which means our body's functioning, right? So when we use ozone therapy in whatever method, what we are trying to do is to improve the oxygen utilization, which means from conceptually, 10 units of oxygen being utilized, you're increasing it to 90 units of oxygen being utilized. So that is the critical role of ozone therapy. And so my argument is, if somebody is considering, anti-aging, I think we should make ozone therapy mandatory to improve oxygen utilization. And here's the secret: when we check a pulse ox and our pulse ox says 97% saturation, that means diddly squat. And I tell you why: because it's not calculating the oxygen utilization. Right? You may have 97 units of oxygen in your bloodstream, but how much of it is actually being delivered to the body? That is not, that's the missing piece. I mean, there are sophisticated instruments that are available right now that can measure oxygen utilization. And I think there are about 5 or 6 centers in the country that can do that. Athletes do that. That's how they know how much of energy that they're utilizing, right? Because you have to calculate the amount of oxygen going in, the amount of oxygen coming out, and so on and so forth. But again, I'm not an engineer or in that aspect. But the reason that I recommend ozone therapy is to improve oxygen utilization. And I do have a new system called an ozone sauna. And what that does is, again, it's not the best way of doing it. You sit in this little sauna, and you guys can go check out on Google, go look at ozone sauna. So it's a little chamber that you stick your neck out and you sit inside, and we pump in ozone gas along with steam. So your entire skin gets saturated with ozone. And what it does is, it creates what's called lipid peroxidation, of the fat in the skin, and that hopefully improves your circulation and your oxygen utilization. So for those people who are phobic to needles, one of the ways of sneaking in ozone into your system is through this ozone sauna. It's just an interesting method of doing it.
I love that because I actually use oxygenated skincare by
Yeah,
Newt, and it is like a driver. It drives in any of my retinoids or hyaluronic acids. Like it's basically just going to push it into your skin further. So everything that you're talking about makes perfect sense. And thank you for explaining the NAD because it brought me to two questions. One being, you said where there is a lack. So as we age, we're going to lose NAD, but is there like a way to prevent that from diminishing as quickly? Is there a way to prolong our NAD that we have? Because it sounds like we have a finite source, like we only have so much. And as we age, it diminishes. And then my second question is, it sounds like how we take vitamin B12 supplements versus taking a vitamin B12 shot. You feel the shot a lot more than you do taking the pill. So I guess that's what you're comparing it to, is that we can take it orally, we can take the NAD orally, but it's not going to be as effective as getting it in our bloodstream, like with
we yeah, we just don't know. We just don't know, because the thing is, FDA is not FDA is not monitoring the content of any of these supplements, right? So we don't know how much of it is for real and how much. And the other variability is the ability of your gut to absorb that. So there's several ifs, ands, and buts in that whole chain between the time that you take the pill and the way it shows up in your bloodstream and at the actual cellular level. You just don't feel it. I mean, you just take it and hope and pray that it works. But hopefully, within the next couple of years, we will have a blood test that can actually measure the NAD levels in our system. And I think that can be a game changer. Because listen, the simpler the way of improving our NAD levels, the better it is for the entire population, because it reduces the cost of care, it improves utilization, without any of these issues of needle phobias and wasting of time, energy, and money. And I think it's going to be good if we can monitor it and say, okay, this method of delivery is the best method of increasing the energy levels. That'd be awesome, but we're still waiting for that to come out.
how do you feel about the Wim Hof method of oxygenating the blood and deep breathing? How do you feel about that? Are you familiar?
The thing is this. So oxygen, I mean, oxygen that's available in the air, right? 21%. You can't do anything more than that. So this is so this is where I differ from hyperbaric oxygen. Okay. So when we are utilizing hyperbaric oxygen, what are we trying to do? We have saturated the hemoglobin to 97% or 100%. So now we are trying to force oxygen into the plasma through that pressure, right? We are trying to push oxygen into the plasma to increase the delivery of oxygen into the cells. And don't get me wrong, it does work. But if the utilization of oxygen at the cellular level is messed up, no amount of oxygen being pumped into the cell is going to work, right? I mean, you have the delivery system. I mean, it's like this, right? If you have a bunch of supplies going to a factory, right, and all the trucks are going in, and you add extra trucks to send all the stuff that is needed from the lungs to the cells, but at the cellular level, there's nobody to unload the dang thing. But you have your supply chain intact. But at the end of the road, at the cellular level, it's not being utilized, quote unquote, utilized, because there's nobody to unload the material into the factory. And that's what ozone does. It helps unload those material into the cell and encourages the cell to utilize that oxygen. And then you add ATP to the mix and NAD to the mix. Now you have a really solid, healthy cell that is functioning at the optimum level, right? You guys understand this part?
Yes, yes. Thank you. Thank you. That was a really good explanation. It's like we have to have the right delivery system. Like you can't get it into the cell if it doesn't fit, you know? So that makes a lot of sense how you're explaining it. I personally have had a lot of positive effects with the Wim Hof method just
Okay.
for anxiety and just for being able to I'm a shooter, so when you're on a range there's a lot of loud noises and bangs and stuff and you need to be calm and focused and stay still and hit your target, and the Wim Hof method has been very helpful for me in anxiety inducing situations like that. And it's also been helpful for my partner that he has stopped taking valsartan. He has
Uh-huh.
stopped Ativan, and he has stopped having to take other anti-anxiety medications because of it, and it was affecting his heart. And I think that's what a lot of people don't realize is how much our minds control our bodies. And, you know, when we are in a state of duress or in a constant fight or flight, that's going to affect our heart. That's going to affect our overall health. So when we can control that, when we can oxygenate the blood, and I'm taking notes on everything that you mentioned, the NR, the NMN, the basis supplement. I'm taking notes on all of these different things. This is a really great conversation, and I appreciate it, Tanya. Thank you for letting me come up to talk.
No, my
Hey,
pleasure.
I want to pitch in one little thing that you just mentioned, right? When you're saying the Wim Hof method helps reduce anxiety and stress and all that. Listen, it's not the oxygen that's doing the trick. It's the fact that you're stimulating the parasympathetic system, the vagus nerve. That is what is reducing the anxiety level and your mindfulness. It's the stimulation of the diaphragm. You know, when we use stomach breathing instead of chest breathing, which means when you inspire, when you inhale air in, you need to let the belly expand, which means the diaphragm is being pulled downwards, right? Stimulation of the diaphragm and compressing the abdominal organs by pulling the diaphragm down is the one that stimulates the vagus nerve, and vagus nerve is the parasympathetic component, and that offsets the sympathetic flow. You see how that works? So it's more than the oxygen that's being utilized. The major impact of this is the parasympathetic system that is uh, doing good work to help reduce anxiety. There's another method of reducing anxiety, and the way to stimulate the vagus nerve is to, have you guys chanted through your throat, which means stimulating the vocal cords in a vibratory fashion, like people say om, right? You're basically speaking or producing that sound through your throat, not through your mouth, not through your tongue. So throat, utilizing the throat as the basis for your voice, whether it's through chanting or singing or whatever, that's an easier way to stimulate the parasympathetic system. You see how that works? And there's a third method of stimulating the parasympathetic system, and that is to massage the top part of the ears. There's a small part of the vagus nerve that innervates that area, and if you stimulate that, you will notice a remarkable reduction in your stress level. That's because you're suppressing your sympathetic system and stimulating your parasympathetic system. So these are some simple things that people can do to reduce their stress level. Remember, we tell people, when they're anxious, say, hey, breathe, 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 take a deep breath. What do these guys do? They lift up their shoulders, trying to take a deep breath. And guess what? You're actually stimulating the sympathetic system. You're making things worse. So the way to stimulate the parasympathetic system is to say, listen, sit down and take a deep breath and blow up your belly. That is the correct method of telling people how to breathe during a stress reaction. Does this make sense? So the key here is, how do we override the sympathetic system and let the parasympathetic system predominate? And that's where mindfulness comes in, along with everything else that I've told you guys.
Dr. Kumar, I was wondering if you could talk a little bit about hormone replacement therapy. You do a lot of that in your practice. And a quick question: do you do telemedicine?
Yes, I do.
Okay, okay, great. So, if you could just explain for the power of hormone replacement for men and women,
Okay.
and just the overall, incredible benefits that people
Okay.
see.
So, so let's talk about men first. And the major thing that we need to worry about is testosterone. So let's talk about that for a second. So testosterone starts declining by about 1% a year past the age of 40. Okay. So 10% decline every decade after the age of 40. Now, when you go through stress levels, addiction issues, all kinds of issues, you're going to start dropping testosterone levels way before 40. So I have patients who come in at the age of 30 with nothing working. Now, the reason we want to talk about testosterone replacement therapy is not just from a sexual point of view, but across the board. I'm talking about mental health, physical health, muscle health, blood vessel health, heart health, brain health, across the board. I mean, my life changed about 4 years ago when, again, thanks to Tanya, made some contact with some great physicians who encouraged me to start looking at hormone replacement therapy. And what I learned from, what I had to do first was to unlearn all the crap that I had learned before I started taking some new information. And since then, my life has changed entirely. The life of my wife has changed because of what I've learned and how to implement this entire program about hormone replacement therapy. So I use a very simple method when it comes to hormone testosterone replacement, and I use a cream, not a shot, not pellets, because I want to keep the cost down and I want to make sure that patients are compliant. And that, so applying a cream twice a day, it's a lot easier than going in and getting a shot every, once a week or every couple of days, or getting a pellet every 3 months and spending, $1,500 to $2,000 for it. It's totally unnecessary. And you get a consistent um, levels of therapeutic testosterone right through the years. So when do you stop it? When you don't want to live anymore. As simple as that. So as long as you're
Dr.
alive, you need it.
Kumar, what was the testosterone cream name you were using? It's a
So
compounded one.
it's a compounded formulation. It is not something that has a chemical attached to it.
Okay, very good.
Okay? So it's a compounded formulation, and it comes in a certain dispenser. Again, if people are looking for testosterone cream, look for what's called Versa base, because that's a better form of creating that cream, which facilitates better absorption. Because what I found in some of the other cream bases that it's used, it's just not working for me. So I found what's called a Versa base. It's a little bit more expensive, but not a whole lot more, but it's worth it. And the other advantage with this is you can manipulate the application or the amount that you apply based on the levels. So it's easy for me to kind of monitor the levels and make sure it's adequate.
And maybe a little bit about women's
Okay,
hormone
absolutely,
replacement.
absolutely. So again, the same reason why people lose, people develop osteoporosis, people develop, I mean, I'm talking about postmenopausal women. Again, my attention is mostly towards postmenopausal women because premenopausal, there are a lot of issues, there are medical issues. So I would have an expert physician talk to these kind of patients. But postmenopausal, which is the area that most physicians are not trained adequately on what to do with them, a hormone replacement therapy, including estradiol and testosterone, both need to be in place, as long, and progesterone. Again, there are contraindications to it. So any cancers that are related to hormones, I would be very cautious. Breast cancer patients, I would be cautious. Ovarian cancer patients, I would be cautious. Cancer of the colons, I would be a little bit cautious. But otherwise, it will change your life in terms of how you feel, how you function, your sexual levels, your libidos, your bone health, your heart health, your brain health. If for no other reason, you should do this to prevent dementia. Again, over the long term. Again, what's the perfect time to start this? Once you are about 2 years into menopause, is when I would start these treatments. Again, there's a lot of misconception about estrogen causing breast cancer and testosterone causing blood clots. It's a bunch of BS. Again, in the right hands, and if you monitor it right, I think the side effects are far less than what people are thought to believe. Does that help?
Oh yeah. I said this last time. Testosterone replacement therapy saved my friend's marriage
Yeah.
and probably his career because it was going down the tubes. He couldn't figure out why he was so depressed. His libido had gone. He was only 44, and I mean, when he got on it, it's like the lights switch went on, and
Yeah.
it changed his whole life.
Yeah.
Um, it was
See,
it was
the other big issue that I did not touch upon is the generational decrease in testosterone in men. Generational decrease. And why is that? The estrogenic stuff that's there in our environment, whether it's in our food supply, the bottled water that we drink, contaminated with all kinds of chemicals in there, across the board. You can't avoid it. So generationally, the levels of testosterone that our forefathers had when they used to have 20 kids, right, doesn't exist anymore. Right? I remember my grandfather had 12 kids. Now, the situation with infertility has gone through the roof, right? Reduction in libido. Yeah, again, we can always ascribe stress levels and all that, but don't forget the fact that we are swimming in estrogenic compounds. Whether it's chemicals through perfumes or whatever, it's in food stuff, it's in chemicals across the board. Again, it's just too complicated for us to kind of tease out what what stuff out there that is consumer driven, has these estrogenic components in them, and what don't. Again, if you do the right kind of research, ask the right kind of questions into Google in whatever stuff that people are using, I think you'll start getting the answers, and you can, take some steps to avoid those.
Hello, Diana. Diana had a question.
Yes, please go ahead, Dan.
Hello. I see that you do an age reversal at your clinic.
Yes.
I'm I'm a caregiver 24/7 for my mother
Okay.
who has Alzheimer's. She's not in the early stages, but she's sort of, I guess, in the middle.
Okay.
And I'm trying to talk with the neurologist about the new procedure, aducanumab, that's out there. But is there anything else I can start looking into or looking up that's on the horizon for treating this? Because I certainly would like to stave it off. I don't want to get to the point where she can't recognize me.
Okay. Listen, the first thing I would do is to figure out either NAD infusion or supplements of any kind. NAD is going to make a difference. The second thing you need to look into is this red light therapy for the brain. And go check out this website called VLight, VIELIGHT.com. They're kind of expensive. It goes into a couple of $1,000 range. There's a system that's 10 hertz. There's a system for 40 hertz, and then there's another system that combines the two. Okay, so go take a look at it. Do your research. If you have any questions, just email me, Dr. Kumar, drkumar at lifewellmd.com, or check out my website, lifewellmd.com. Reach out to me. But I would get this started like right now. It's going to have a huge benefit in terms of, again, there's a lot of research going on in the Alzheimer's dementia area using this kind of red light therapy to the brain right now. But again, I can't wait for another 10 years to get the results. It doesn't hurt. If it helps, wonderful, because we don't have anything else that works right now.
Is there any insurance? Is Medicare covering this red light therapy you're talking about?
No. This is home based. This is something that you guys buy through VLight. It's a Canadian based company, and you use it at home 20 minutes twice a day.
Oh, okay.
Like I said, go check out their website. Again, this is all experimental, like I said, but I know it doesn't hurt.
And you said energy, like B12?
Yes. Again, B12 is for all of us. Vitamin D3, all of us. If you have a pulse, you need it. And I would also put her on low dose naltrexone, LDN. Okay, I can take it up from 1 milligram a day to 4.5 milligrams a day. Again, why? For mental health. Is it specifically for Alzheimer's disease? I don't know. But does it hurt? No. Does it help? Might. Is it expensive? No.
Okay. All right. Thank you.
All righty. Thank you. You're welcome.
So it's about 12:04. I want to go be mindful to Dr. Kumar as far as the 60-minute mark. But I want to does anyone want to ask a question? Pick up the mic. We got a few minutes, for like 2 minutes. I want to be mindful. And Brian, did you have anything else you want to ask?
Yeah, I just wanted to ask him about his practice. So, are you accepting new patients, Dr.
Absolutely.
Kumar, from out of state? How does that work through telemedicine? So, for example,
So
I'm in Virginia.
telemedicine, again, I'm licensed in the state of Florida and California. So
Okay.
again, when it comes to across state lines, it all depends on the licensure requirement of the particular state that people call from. But if people have a Florida address, that should not be an issue.
I see. And so, uh, say where I live, Virginia, that would depend on the state. Pretty lax here in the state.
Yeah. Okay.
They let physicians assistants prescribe drugs, so I think it should be okay.
Yeah, it should be okay.
So, I know I'm fascinated about like all the new technologies that you're embracing in your practice, especially the gains wave, which is phenomenal.
Oh, yes. Don't get me started on that. I won't
Yeah,
stop talking.
can we do that for another space for men's health?
Absolutely. I'd love to talk about that.
Real quick, you mentioned something about the sound app or machine, or I think it was an app last time that can modulate your brain waves if it's theta waves or get
Yes,
into
yes,
deep
yes.
relaxation. Could you talk a little bit about that?
Okay. So PEMF, pulsed electromagnetic field therapy. Okay. So let's focus just on the brain area. There is a system called NeoRhythm, NEO Rhythm, RHYTHM.com. Guys, go check it out. Okay. What it does is it creates this pulsed waves, and there's a way of using it, and there's a bunch of YouTube videos too. I use it every day. So that is something that people may want to look at. Again, you need to use it for about 20 minutes a day. It also comes in as an app, so you kind of play around with it. What else? The other thing that I think at some point we need to kind of discuss is intermittent fasting, and um, and how to figure out heart rate variability. There's a lot of things in those areas. So there's a lot of unexplored areas that we can really touch upon the next time. Gainswave is one of them.
Oh yeah, there's a lot of people ask me questions about intermittent fasting and time restricted eating, and that whole effect on your gut microbiome and your insulin system, and just so many benefits.
So as a take-home message, the simplest thing that anybody can do for age reversal or anti-aging is intermittent fasting. Even if you forget everything else, if you just do intermittent fasting, 90% of your problems are taken care of. That's my take-home message. And if you can sustain it, that's the key. You guys have to be able to sustain it. Make that as a life habit.
I went 20 hours without eating the other day because I got because Facebook was down, so I had to open up a Twitter Spaces to talk about. So I totally missed my lunchtime and dinner. It seems that way. But I did my whole intermittent fasting without even having like a thought about it. My first day doing it. So but the next day I couldn't go that long. But usually I do 16 hours.
Yeah, that's what I do too. That's what I do too. But then if you add these other things, listen, I'm 62. I just turned 62 a couple of days ago. Shucks. I feel like I'm like 40.
You sound 42, Dr. Kumar. I'm not kidding you.
Thank you. No, but life has been good. Life has been good. Again, nothing physically has changed in my life. I still have the same relationships and problems with kids and business and whatever. But you know what, man, I've been able to handle things. Built up resiliency, and my life is just awesome and amazing. I mean, I've never been this happier ever in my life, whether it was the time that I finished medical school or got into residency or got out or made my millions of dollars or whatever. I mean, right now, like, I'm at the peak of my career. And this is, I mean, again, radiation oncology is still my core. I mean, that's my passion. But everything else kind of started with trying to help my cancer survivors where nobody else could. And oh my God, that was a niche that I really love. And thank God it's kind of spilled over into this arena. And then I bumped into Tanya, and that took me off at a completely different level. I mean, it's been really good. Thank you, Tanya. I mean, you have
No,
no
my
idea
pleasure.
the kind of
We got a
changes you've
big
created.
project coming up too that you're a part of. That's launching.
Okay.
I don't think you know about it yet, but your name's being put to the front.
Okay.
We'll
Cool.
talk more about it later, but I'll tell you
Okay.
what's going on that project.
Okay.
But,
Cool.
But final thoughts. Terry, did you want to share final thoughts on anything? I'm going to go ahead and close out this space. And go ahead, Brian.
Dr. Kumar, real quick, how can people reach you at your clinic?
Okay, the lifewellmd.com is the website, and text message 772-332-9975. Text message, easy.
Okay, great.
And we'll
don't
take
forget
it away
to follow him
and
on Twitter.
This is Terry, Dr. Kumar,
Yes,
and Tanya. You guys have changed my life. So if anybody wants to hear about it, you can get my phone number from my website. And Tanya, you need to make an appointment to see him ASAP for me too. For the
NAD. I'll be here.
All right.
Yeah, we got to prepare for the holidays. We got to get our brain ready.
Ma'am.
Yeah. Let's get it together, guys, please.
All right.
Thank you. And you know who I'm going to have on next, Dr. Kumar? I'm going to tell you this too, Brian. I just finished. I got to get the date down with him.
Okay.
He wrote Ross is his first name. He wrote the book. He was at Radfest. He wrote the book on rapamycin.
Yes.
And mTOR. So I want to have him on. So maybe you can come on too, because
awesome.
He's sending me the transcript to look at, to read up on.
Yeah, I think he's going to be coming out in December. He said it's still not out yet.
We're gonna get the sneak. He wants to hire me, but I told him let's do a Twitter space first.
Yeah.
And let me see how well we love each other first before I take you on as a project, because I'm just really weird about taking people on. I love Dr. Kumar, and whatever he needs, I work on every project that he's on. But certain people you gotta make sure that you like. It's like dating. You gotta make sure you like them before you
vibe. The vibe. Totally.
Yeah, it's totally the vibe, right?
Yep.
So he's going to be coming on. I'm trying to confirm with him by the end of the day, hopefully by next Wednesday. But he's sending me the transcript. The book is not published yet. We're going to start talking about it and talk about rapamycin and mTOR, all that good stuff that everyone should know about.
Yes. This was a great conversation. I just have a couple of things that I want to follow up on, and then I'm going to let you guys all go, because this was amazing and I've learned so much, and I literally have like a full notepad full of notes just to make sure. The sound app, can you tell me again the name of the sound app?
It's called, it's not a sound app. It's Neorhythm. It's PEMF. It's pulsed electromagnetic field.
Yeah, that part I got, but what was the dot for it?
Oh, the sound, oh my God. Are you guys talking about the sound bed or the sound waves?
You said it was a website. You said
it was the sound waves that stimulate theta waves, Dr. Kumar.
Well, that's the PEMF, neorhythm.com. Neorhythm.com.
Okay, great. I just want to make
the PMF. That's the PMF. Yeah. So the other one, the red light therapy is V-Light, VIELIGHT.
And that works. I just want everybody to know, I think it was Diana who was in the room. I wanted her to hear that actually works. That light therapy, I have also used that for like wounds on the skin, and how quickly it turns over the cells and helps the cells heal. And if it can do that to our skin, I can imagine what it can do to our brain. And I've seen it in real life. Like, it works in 20 minutes, 30 minutes. It is expensive, where it's like to sit under it for 20 minutes is like $300, like very, very expensive. So if you can buy your own machine, do that. And this has just been an amazing conversation. To talk about the ohms was another thing, because that is massaging your central nervous system. It is literally tapping in to your entire, nervous system, and massaging your ears also. And how much you talk about mental health, because that is what the vitamin D and the B12 is going to affect, is your mental health. And if you don't have your mental health, you're not going to have any health, period. So I really appreciate this entire conversation and all of the things that everybody has touched on. And I can't wait to hear more. Please keep me posted, Tanya. I want to hear about the rapamycin guy. I don't even know what that is, but I'm going to Google it right now after this. And thank you so much, everybody, for letting us talk about all these important things: living longer, living healthier, living happier. Because there's no point in having all of this, monetary wealth or accolades or achievements if we can't have our mental health to actually appreciate it. So I really, really, this means a lot to me, to wake up and be presented with this opportunity to talk about all of this with everyone in the room. So thank you so much, Tanya, and thank you, Dr. Kumar, and thanks, Brian, and thanks, Terry.
Thank you. I will talk to you later. And again, thank you, everyone. I want to say hi to my good friend Shannon. She's back. She'll be back on her Twitter Spaces at 10 a.m. Weekday, and I was just in her space. I want to give a shout out to her. And Social Audio Guy, who's always hosting a story hour, more than a story hour. You share your story with him. I thought it was Friday, but I'll give you an update on that on his Twitter Spaces. And Brent and I, who is in the space, I host a Twitter Spaces with him. I'm his co-host. I'm his sidekick. He's always telling me, "Come on, Tanya, let's do this." I'm like, okay. And again, Terry, thank you for joining. And always, Brian, you are one of the best co-hosts ever. Thank you so much.
Thank you, Dada. Thank you, Dr. Kumar.
Thank you, guys. Take care.
Okay,
Thank
everybody, have an
everybody.
awesome day.
Until
Bye.
next
Love
time.
you.
Until next
Bye.
time. Bye.
Bye.